As you know, our body works in conjunction with itself, and so when something is out of whack, there's often a complication that arises from it. During blood filtration, it's possible for the specific salts in the filtrate to become supersaturated. When this happens, kidney stones form. Occasionally they pass through the urinary system without treatment, but there are instances when they can cause an obstruction or unbearable pain, and they must be treated surgically or with lithotripsy. Kidney stones can become obstructed in the kidney or even in the ureter. There are specific procedures performed for these instances, so be sure to indicate that on your reports where applicable. Bladder stones are usually the result of retained urine due to the incomplete emptying. The concentration of the urine can cause crystals to form, and then those crystals become a bladder stone. I've only seen a few bladder stones in my career, but the ones I did see were ridiculously gigantic. I can only imagine the pain they inflicted on those poor patients. The final anatomical structures to discuss that are found in both males and females are the adrenal glands. Surgeries on these glands may be performed by either a urologist or a general surgeon. Their purpose is to secrete hormones and produce norepinephrine and epinephrine, which is critical to the functioning of the autonomic nervous system. The ANS is responsible for bodily functions that are not consciously directed, such as breathing, heartbeat, and digestion. Know that the adrenal glands are very, very vascular, and should you be involved with a laparoscopic adrenalectomy, one wrong move and blood loss can be significant, which is why we are always prepared to open. The image on this slide shows the various structures we are about to discuss. You can also find it in your book on page 614. You need to know their location, their purpose, and what it means for the patient when they aren't functioning properly. First up is the scrotum and testes. The testes are the male reproductive organ. Sperm and testosterone are produced in the testes and then communicate with other structures of the male pelvis. The testes are located in the scrotum, which is a sac-like structure that is continuous with the male perineum. The scrotum reacts to the environment it is in to protect the spermatozoa produced in the testes. Because there are two testes, there is a septum in the scrotum that divides it into right and left sides. Each testicle has a duct system attached to its superior edge called the epididymis. The epididymis secretes seminal fluid through the attached vas deferens. It is within these structures that the hydrocolectomy, spermatocolectomy, vasectomy, orchiectomy, and orchiopexy take place. The vas deferens pass through the inguinal canal across the bladder and ureter where it meets the seminal vesicle. The vas deferens and the seminal vesicle are two separate structures, but they both empty into the ejaculatory duct. The ejaculatory duct then empties into the urethra, which travels through the prostate, whose purpose is to secrete fluid that protects and nourishes sperm in the seminal fluid, then past the Cowper glands, which secrete mucus, which is the final product of seminal fluid. Know that the testes form sperm, the sperm travels through this network of anatomy, and that is the reproductive side of urology. The testes also produce testosterone, which is the primary male sex hormone, but it is not an isolated hormone that is only for reproduction, like all the previously discussed structures are for reproduction. Testosterone also has to do with overall hormonal balance in males. The final anatomical structure we concern ourselves with in the urology unit is the penis. There are 3 columns of erectile tissue, 2 dorsal, spongy columns, and 1 central column that encloses the urethra. These columns fill with blood during sexual arousal and create an erection. The distal portion of the column that surrounds the urethra is the same tissue that forms the glans penis. The glans penis is covered by foreskin, which is the specific tissue removed during a circumcision. That's the anatomy involved in urology. From here, we will move toward perioperative considerations that we surgical technologists must make for our patients. You'll remember from a previous slide that the kidneys are very important because they filter toxins from our blood. Think back to that previous video. What itsy bitsy anatomical structures do this for us? How many of them do we have? Write it down again. Pause me. I'll wait. Okay, so you better have written down that the nephrons communicate with the glomerulus and filter the blood. In the event that the kidneys are not functioning as they should, say because a patient has chronic renal disease or end-stage renal disease, that patient must have dialysis. If they don't get dialysis, they will die. A person cannot live without functioning kidneys or something that does the kidney's job for them. Period. So, if a patient is suffering from renal disease and needs dialysis, there are a few things to know. 1. Dialysis is not actually performed in the OR. Preparation for dialysis may be. Dialysis needs to be performed 3 to 4 times every week, and each treatment lasts about 3 hours. Think about that. All of a sudden, 12 hours of your life every week you have to be hooked up to a machine or you'll die? Ugh, yikes. There are 2 types of dialysis, hemodialysis and peritoneal dialysis. The treatment selection is determined by the physician and the patient will be referred accordingly. For patients who need hemodialysis, they often are referred to a vascular surgeon so that they can have an arteriovenous shunt procedure, which you will learn about in the vascular unit next semester. But in a nutshell, an artery is attached to a vein, this is usually in the forearm, using an end-to-side anastomosis, and the arterial pressure supports the vein with additional blood so that when the IV is put in their arm 3 to 4 times every week, the vein doesn't collapse and make it impossible to get a good IV. If that's confusing to you, let me know. I will definitely explain it again, and we'll go over it next semester as well. For the patients who are candidates for peritoneal dialysis, their urologist will refer them to a general surgeon who will place a peritoneal dialysis catheter in their abdominal cavity. Through this catheter, a dialysis solution can be instilled into the abdomen, and through the process of osmosis, the blood is filtered, the toxins are extracted, and then they're drained out of the body via that very same catheter. The benefit to the PD cath is that this process can be done at home, sometimes even when the patient is sleeping. Okay, that's dialysis. It's kind of a big deal, so if you've got questions, let me know. Ultimately, what you're learning about is that dialysis is what the patient is dealing with, and this ultimately develops empathy on our part. Empathy is the thing that we have to constantly exercise so that our patients don't just become a number to us. There are only 2 surgical procedures that resulted from patients going on dialysis, and neither one of them are even being performed by a urologist.